We are the Association of Nigerian Private Medical.
We want to build capacity across the largely ill-equipped caregivers in our rural communities, improve the quality of care to our pregnant mothers, save their lives and save their children. We project to save 1 million Nigerian mothers and their children over the next 5 years. This is our concept and philosophy and vision of the Save 1 Million Nigerian Mothers initiative. In like manner, we desire also to grow awareness, understanding, acceptance, and support for our health insurance by the Nigerian people as a means of actualizing universal health coverage come 2030. This is our AGPMPN Awake Project 2030. What we are saying here is that the Nigerian system is asleep. The average Nigerian out there does not understand what health insurance is about. And yet, this is one omnibus you get into, and whatsoever you desire as far as accessible and affordable and quality care to everybody in society, irrespective of socioeconomic divide, is found. And until that day comes, when the average Nigerian out there will not panic when he's ill, or when the wife is ill, or the husband is ill, or the child is ill, because he doesn't have to look for money. Until that time comes, then the healthcare system is still sick. This is why, as private doctors, as part of our own gift to Nigerians at 100, we want to partner with stakeholders to educate Nigerians across the entire system to become aware and partner and accept that health insurance is the way to go.
Today, having assembled, we will listen to contributors, our lecturers, and men and women from various sectors of the economy give their goodwill message. Every goodwill message is another contribution, a perspective to the experience of that organization in their sector of the economy. Remember, we are private sector. We are the highest consumers, and we are the highest providers. But we do not have a voice. We do not seem to have influence. We want to have a greater and deeper partnership with our government. And I am deeply delighted that the SGF itself is here. The SGF has been passionate about the healthcare delivery system. It has told Nigerians that government will not rest until we revive the health sector that have been discovered to be very weak and unable to meet its obligations. And since this administration came into power, everything is being done, and we want to partner with them, whatever we can do as professionals and leaders in the system. We are opening our arms to embrace government. And we are saying to government, send us, we are willing to go. Empower us, we are prepared. Give us the support, we will reverse medical tourism. My dear colleagues, and I'm sure you believe this is the situation. Federal government, we are here to support you. In conclusion, we are sending our invitation. We are calling on fellow Nigerians, calling on stakeholders, partners, chieftains of companies and organizations, our international friends. We are saying that we cannot, as a private organization, continue to complain and lament and yet walk away. We are tired of complaining. We want to take action. We want to give more than we are giving. Because remember, the private doctor out there is not a businessman. The SGF, they are not businessmen. They are social workers. They are doing so much for this country. There are tens of doctors here who will give you account of how they will open themselves to the emergencies around, undertake very expensive surgical operations as emergencies, and at the end of the day you discover, because the doctor in an emergency is a spirit. Maybe this is the best way to put it. That doctor is no longer, he doesn't remember a second thing except save that life, save that life, save that life. Even in the physician's pledge, one of the lines of the physician's pledge says, "The health of my patient shall always be my first consideration." The SGF is as best as that. The doctor forgets his name, he forgets he has not eaten, he forgets that he's alive. He died taking his own life for that patient. By the time he is done, 7 out of 10, the patient turns back to tell you a story of how he has been jobless for 20 years. Husband is jobless, nobody in the house, nowhere to go. The point is, having rescued that woman and saved her child, will the poor doctor send the baby back into the womb? No. Will you build a cell and keep that woman? No. You will let go. You will let go. The SPF, sir, we are saying that our country is old enough, we are strong enough, viable enough, rich enough, and endowed enough, that there should be such a standard, a measure, a mechanism in place. And I must say, sir, that mechanism is in place, but it is not enforced. The Nigerian Senate of 2018 gave us the basic healthcare provisions fund, that 1% of the dedicated revenue of the federal government is needed to help to support the low budget. A great idea. 5% of that 1% is designated for what? Payment for emergencies. But as we speak, sir, the process of getting it to function is what we are struggling with. 3 years after, we are appealing to the SGF that by his presence in this garden today, he should see the tears of his private doctors and hear their cry. That whatever can be done should be done. That in no distant measure, this great ideal of government should be given legs, it should be given reality, and it should be given substance. We want to see that your doctors who are slaving out there, who are committed, struggling with the economy, without incentives, without support, sir, the cost of borrowing from the bank by your doctors is the same cost by oil companies. No difference. No difference. How can we survive? We are all struggling. In other spheres of the economy, in other countries, sir, there is a health bank, like there's an agri bank, and there is a bank of industry that gives single-digit loans for long tenures and, of course, long moratorium to allow these people who are in a business that is not fast yielding. Our business is not fast yielding, sir. I'm aware of businessmen, contractors who go and do a road work, a road construction work that will cost 100 million naira. They will end up with more than 900 million in their pocket. For the doctors that we are dealing by Panadol, tablet by tablet, the margin is so low, especially since COVID-19. My colleagues will tell you, sir, almost every day you see on the paper, private doctors are putting up their clinics for sale. They are all frustrated, and they are leaving the country in drones. What is left? Out of the 75,000 doctors that we have produced, more than half are out of Nigeria. Even if the entire 75 were around, they don't measure up to 10% of the WHO provision for the doctor-patient ratio of 1 to 600. We are struggling with about 1 to 5,000 today. It's a very discomforting reality. On this note, ladies and gentlemen, I want to appreciate you for coming. It is because of all these I have reeled out and many more, in pain and in fury, but determined to help to salvage the situation rather than jump out to save other people when our own home is on fire. That is why, dear Chair and our dear Chairman, we have put this town hall meeting together to cross-pollinate our ideas and to speak to the issues and interrogate our past and design a new future for ourselves. We are believing that at the end of the day, this meeting will produce the necessary blueprint and the pathway to truly unifying our thoughts with that of our government. Working together, nothing is impossible. We will get there. Thank you and God bless you.
Thank you very much. Thank you. Our president has spoken like the president that he is.
The greatest measure of a nation's wealth is the health of her people.